At Hendricks Regional Health, our patients are not just a number.
You're a patient, you're a community member, you're our family, you're our friends, and you're going to get cared for in that same fashion.
The 5-star rating I am most proud of is our patient experience rating. We have been given this rating 10 years in a row.
What used to be a smaller hospital in a small town is now growing exponentially to the point where we're seeing all levels of acuity, not just from the western parts of the state, but also from the suburbs and downtown Indianapolis.
Sometimes patients need care at a time their physician's office is not open, or they need a level of care that they know that their physician's office can't provide. That's what they utilize our immediate cares and our emergency rooms for.
We've got immediate care centers in Avon, Plainfield, and Brownsburg that provide great care in a timely fashion.
An immediate care center is there for what we would consider the typical illness, coughs and colds, sprained ankles, where a physician needs to see you, but it's not necessarily an emergency. The emergency department is just that. It's there for emergencies.
If you have a significant amount of pain, then maybe the emergency department is the better place to go because we have the medications to treat that pain in a different way that the urgent care might have.
As patients present to our emergency department, they're met by a nurse who does an assessment to determine how acutely ill they could be at that time.
We're proud that our wait times from the time a patient would check into our emergency room until they see their provider is under 20 minutes.
Patients can go online and see the wait times, and those are updated in real time. Our emergency department has the equipment, and our staff have the skill set to care for anything that walks through our doors.
The faster that we can see you as a physician or a physician's assistant and get the test rolling, the faster that we can get those results back and then give you an answer as to what brought you into the emergency department.
We are cardiac and stroke accredited, so we're able to take care of that population as well.
We have health grades 5-star ratings in COPD, stroke care, and patient experience.
We are a primary stroke center. We have streamlined the process to when a person gets to the door having a stroke to when they get brain-saving treatment.
Telestroke is an electronic monitoring system that we have put in place in local ambulance services.
When they're transporting a stroke patient to our facility, they literally can provide live video feed of that patient. We can, as physicians at the hospital, evaluate that patient and make treatment decisions before they even arrive.
The national standard for TPA, which is the clot-busting medication that we use in stroke, is less than 60 minutes. At Hendricks, we've always been able to surpass that goal.
At times, we are able to deliver that medication within 30 minutes.
Hendricks is consistently adapting to the volume of our patients in an area, but also adapting to their needs.
As our community continues to grow, Hendricks continually looks at what type of services we're able to provide for them.
Hendricks Regional Health Brownsburg Hospital is expected to open soon.
The Hendricks Regional Health Brownsburg Hospital will have a full emergency department, immediate care, and physician offices, as well as inpatient beds to provide great care to that part of our community.
We will be providing the same high level of emergency care that people have received in Danville for years. Our primary mission in the emergency department is to manage your acute healthcare needs. Once those have been met, it's also as important to make sure that you get into your primary care provider so you don't get back to the point where you have to visit the emergency department.
In our emergency department, we have a ED nurse navigator that helps facilitate patient continuity of care after their discharge. Hendricks initiated the ED discharge clinic so that we could help our patients stay at home.
I'm exceptionally proud of the people that I work with here at Hendricks. The providers that you have in the emergency department are world-class and board-certified emergency physicians.
We've got a lot of people who really care about patients, about taking care of other people, about taking care of our county and our community. They're just awesome to work with.
We are well rooted in this community. It has been around for over 55 years with the sole purpose of taking care of the families and the patients of Hendricks County.
When you walk in the door, you have a better chance of being seen rapidly here at Hendricks than you do at any other hospital in the county. I don't think there's anyone that does it better than us.
Learn how we're growing healthcare for our community at hendricks.org/emergency.